The heightened awareness for the problems of health and environment have led us to question the indiscriminate use of medication. This film is intended as a guide to the possibilities of acupressure treatment. Acupressure is a part of traditional Chinese medicine. Specific points on the surface of the body are stimulated with a remedial effect. In the case of acupressure, these points are stimulated by pressure or massage. Used. Obviously, both methods are closely related. Acupuncture should only be practiced by the knowledgeable physician, but acupressure can be practiced by the patient himself as a method of self-help. Before any therapy, it is important to know the cause of the disorder. Therefore, a doctor's diagnosis is essential before treating oneself with acupressure. Especially when new symptoms or complaints develop, the doctor's examination and diagnosis is essential. Acupressure is best used in cases of light or moderate pain, nervousness and anxiety, stomach and intestinal disorders, constipation, and menstrual complaints. Acupressure is based on the system of Chinese medicine, with the treatment of points and channels of the body, by which imbalances of the body energy are reharmonized. At first, the most important points will be introduced with their strong effects. For example, pain relief, psychological sedation, or activation of body energy. At first, we will introduce the major acupuncture points. Large intestine 4, in the muscle between the thumb and forefinger, is the most important pain-relieving point of the body and also has a strong effect on disorders of the head and face area. Large intestine 11, located at the end of the elbow crease when the arm is semi-flexed, is an important immune-enhancing point and is also effective in the treatment of low blood pressure and general fatigue. Strong massage in a circling motion for 1 to 2 minutes on each side. Triple heater 5 is located 2.5 finger breadths above the wrist crease between the two bones of the forearm. Triple heater 5 is used against pain on the side of the head and at the back of the neck and against the symptoms of a common cold. Firm massage of the point for 1 to 2 minutes. Pericard 6, located 2 finger breadths above the wrist crease on the inner side of the arm between the two bones of the forearm, has a strong relaxing effect on stomach and intestines, also against nausea and vomiting, dizziness, cough, and heartburn. Heart 7, located at the end of the wrist crease on the side of the small finger, is also called gate of the spirit and has a strong sedative effect on the mind, for example, against anxiety, nervousness, irritability, and insomnia. This point should be massaged for 30 to 60 seconds with the nail of the thumb or forefinger. Lung 7, on the edge of the bone, 2 finger breadths above the wrist, is used for illnesses of the respiratory system, such as bronchitis, cough, and hoarseness, and massaged for about 30 to 60 minutes with the nail of the thumb or forefinger. Small intestine 3 is located at the end of the crease across the palm of the hand. Small intestine 3 has a distant effect on tensed muscles at the back of the neck and pain originating from the spine in this area. Massage firmly with the nail of the forefinger for 30 to 60 seconds. Stomach 44 is located above the web between the second and third toe. This is the most effective point for pain relief located on the leg, and it is especially effective for the head. Strong acupressure is applied with the nail of the thumb or forefinger for 1 to 2 minutes on each side. If you feel up along the edge of the shin bone until a roughness is felt, stomach 36 is located 1 finger breadth next to this. This is the most important point for the treatment of gastrointestinal disorders, such as nausea and vomiting, stomachache, diarrhea, or constipation. Stomach 36 should be massaged firmly on either side for 1 to 2 minutes. Spleen 6 is located the width of the patient's hand above the ankle on the inner side. It is used for the treatment of genitourinary disorders as well as for painful menstruation and is massaged for 1 to 2 minutes. Urinary bladder 40 is located at the midpoint of the crease at the back of the knee and has a strong distant effect on low backache and sciatica. Firm massage for 1 to 2 minutes. For low backache, urinary bladder 40 is often combined with urinary bladder 60, which is located in the depression between the tip of the ankle on the outer side and the tendon of Achilles. It is an important distant point for low backache, lumbago, and sciatica. In addition, it has a strong effect on the back of the head and neck. Massage with a circular motion with the thumb or forefinger for 1 to 2 minutes. Repeat this treatment hourly until the symptoms disappear. In the following part, the treatment of a variety of disorders will be demonstrated. At first, acupressure of the urinary bladder 2 points against frontal headache is shown. This point is at the end of the eyebrow, exactly above the inner corner of the eye, and can be very tender. Accordingly, pressure should be gentle and in a circular motion. The next point, extra 3, is at the midpoint of the eyebrow. This point may also be very tender because nerves exit here and should therefore be massaged accordingly. Next, triple heater 23, at the outer end of the eyebrow. Stomach 8 is located obliquely above the outer corner of the eye, inside the hairline. Strong circling massage for about 1 minute. The points in the vicinity of the disorders are called near points. In addition, so-called distant points are used for acupressure treatment. For example, large intestine 4 as shown here, with a strong effect on the face and head. Large intestine 4 is the most effective pain-relieving point of the body. Strong massage of the muscle between the thumb and forefinger, usually for 1 to 2 minutes on both sides. Next, we will demonstrate the treatment of headache on the side of the head, with the point stomach 8 within the corner of the hairline. The near points in the area of the pain are generally treated for 60 seconds on both sides. Gallbladder 8 is located 1 finger breadth above the highest point of the ear. Acupressure with a circular motion. Gallbladder 20 is located the width of the patient's hand behind the ear, in the depression where the neck muscles originate. This depression is usually very tender, and the massage should therefore be gentle here for 1 to 2 minutes. Distant points are triple heater 5, 2½ finger breadths above the wrist crease between the bones. Massage this point strongly with a motion parallel to the bones. If done properly, a strong feeling of pressure will develop. As always in the case of pain, large intestine 4 should be used as the most effective pain-relieving point. Large intestine 4 should be massaged for 1 to 2 minutes. The acupressure treatment generally takes 8 to 10 minutes and is repeated hourly until the pain is relieved satisfactorily. The treatment of pain at the back of the neck is shown next, with gallbladder 20, located the width of the patient's hand behind the ear. You can feel the point in the depression where the neck muscles originate. Urinary bladder 10 is located at the back of the neck on the muscle bulge next to the midline. In the case of pain here, but also during a headache at the back of the head, this point can be very tender or painful. Then acupressure should be done very gently and carefully. As the pain lessens, pressure can be increased. Now, gallbladder 20 on the other side is treated. Local points are treated for 30 to 60 seconds. The point, gallbladder 21, is located at the highest point, midway between the shoulder joint and the spine, and is often tender. Extra 17 is located 1 finger breadth next to the 7th tip of the vertebra, the most prominent vertebra. When the head is bent forward, it is seen well. Now extra 17 on the other side will be massaged. Gallbladder 21 on the other side. The highest point of the shoulder. These are the near points in the painful area. Generally, they are treated on both sides. Distant points for this area are small intestine 3 and large intestine 4. Small intestine 3, at the end of the crease across the hand, is massaged strongly with the nail of the forefinger for 30 to 60 seconds. A feeling of pressure should develop here. Large intestine 4 as a pain-relieving point, and with its specific effect on the back of the neck area, is massaged firmly for 1 to 2 minutes. Strong effect on the neck region, urinary bladder 60 is also used. This point, located in the depression between the outer tip of the ankle and the Achilles tendon. Urinary bladder 60 should be massaged firmly with a circular motion for 1 to 2 minutes. The treatment can be repeated after 1 hour. In the treatment of shoulder pain, 2 points are used which become palpable as 2 depressions on the shoulder joint when the arm is raised. The rear one is triple heater 14. The front one, triple heater 15. 1 finger breadth above the back axilla fold is the point small intestine 9. Acupressure of these near points is usually done for 1 to 2 minutes. At the highest point of the shoulder, the point Gallbladder 21 is located, which is also used for pain at the back of the neck. In cases of shoulder pain, this point is also often very tender. Extra 17 is located 1 finger breadth next to the highest vertebral tip of the neck area. These points are also massaged firmly for 1 to 2 minutes. As distant points, large intestine 4 on both sides is treated, as shown here. Massage firmly. Stomach 38 is located 10 finger breadths below the tip of the knee and 1 finger breadth next to the edge of the shin bone. This is the most important point with a distant effect on the shoulder area. This point is treated with a circular motion for 1 to 2 minutes. In the treatment of pain in the face area or upper toothache, the point stomach 2 is used. It is located 1 finger breadth under the middle of the eye. A nerve exits here and a small depression can be felt. The point should be massaged with a circular motion. It may often be tender. Next, stomach 3, below the middle of the eye, at the level of the wing of the nose, is acupressured. If it is very tender, it should only be massaged lightly. Triple heater 23 is located at the outer end of the eyebrow and is acupressured with a circular motion. Small intestine 18 is located straight below the outer corner of the eye, just beneath the cheekbone. This point should be massaged deeply also in a circular motion. One finger breadth behind this is stomach 7, on a strong cushion of muscle, which may often be very tense. The point should be at first massaged lightly until the muscle relaxes. The near points of the face are usually treated for 30 to 60 seconds. For pain in the lower portion of the face, or for lower toothache, extra point 5, one finger breadth next to the midline below the lower lip is used. Stomach 6 is next to this point in the middle of the jaw angle. On the edge of the muscle for chewing, it should be massaged with a circular motion. Additionally, distant points on the arms and legs are selected. Here, large intestine 4, with its strong pain-relieving effect, is massaged, followed by large intestine 11 at the outer end of the elbow crease. The lower arm muscle is massaged firmly at this point. This point has a harmonizing effect on the bodily functions. Stomach 44 is located one finger breadth above the web between the second and third toe, and should be massaged strongly with the nail of the forefinger in a circular motion. The distant points on arms and legs should be massaged for 1 to 2 minutes. For low backache and sciatica, a group of urinary bladder points are used which are located parallel to the midline, 2 finger breadths away from the spine. Points located the width of the patient's hand above and below the area of greatest pain should be selected. Even if the pain is limited to one side, both sides should still be treated. The points are located by moving away from the space between 2 spinal processes, 2 finger breadths to the side. Above the sacrum, a slight dimple can be felt. Nerves exit here, and this point may therefore be very tender. Massage it only gently, or move on 1 finger breadth to the side. Pressure with the thumb. As distant point, urinary bladder 40 in the middle of the knee crease is selected and acupressured very firmly. Massage firmly with the thumb for 1 to 2 minutes. Urinary bladder 60 behind the outside tip of the ankle is massaged strongly with the thumb or forefinger. In the case of backache, the patient should be treated in a comfortable position, preferably lying down. Distant points should all be treated for 1 to 2 minutes. The treatment should be repeated after 1 hour. Stomach ache, nausea, vomiting, travel sickness, and the like are treated with points 2½ finger breadths next to the midline in the front. This is stomach 25, located 2½ finger breadths next to the umbilicus. It is massaged for 1 to 2 minutes with a circular motion. This treatment can be repeated after ½ an hour. On the same line, but 5 finger breadths above the umbilicus, is stomach 21, and it is also treated with a circular motion and massaged strongly. These are the local points for the abdominal region. 5 finger breaths above the umbilicus. The most important distant point is pericard 6, 2.5 finger breaths above the inner wrist crease between the bones. The point should be treated with strong pressure from the forefinger for 1 to 2 minutes. In mild cases, the use of pericard 6 alone may be sufficient. Here, heart 7 is treated at the end of the wrist crease on the side of the small finger. It is a very effective sedative point. As a distant point, stomach 36 is very useful. For constipation, first, triple heater 6 is selected, the width of the patient's hand above the wrist joint, between the bones. It should be massaged firmly, parallel to the bones for 1 to 2 minutes. The treatment of this important distant point for constipation can be repeated after half an hour. As local points, we again select stomach 21, 2.5 finger breaths next to the midline. This point is located 5 finger breaths above the umbilicus. It is massaged with a circular motion. Next, stomach 25, 2.5 finger breaths next to the umbilicus is massaged with a circular motion. These local points in the abdominal area should be massaged for 1 to 2 minutes. Stomach 29 is also massaged with a circular motion. This point is 5 finger breaths below the umbilicus. Stomach 29, 5 finger breaths below the umbilicus. Distant point for constipation is stomach 36, 1 finger breath next to the shin bone. It is treated with firm massage parallel to the shin bone, as shown here. Massage with the forefinger for 1 to 2 minutes. Stomach 36 is the most important point for all kinds of abdominal disorders. For the treatment of menstrual complaints, a point located 5 finger breaths straight below the umbilicus or 2 finger breaths above the edge of the pubic bone is useful. It should be massaged circling for 1 to 2 minutes. Five finger breaths straight below the umbilicus. Distant points are liver 8 at the inner end of the knee crease, massaged with a circulating motion. Firm massage for 1 to 2 minutes. Next, spleen 6, the width of the patient's hand above the inner tip of the ankle, behind the edge of the bone. These distant points should all be massaged firmly in a circular motion for 1 to 2 minutes. In case of severe menstrual pain, the point large intestine 4 between thumb and forefinger is also indicated. For menstrual complaints, Moxibustion may also be useful. Against anxiety, nervousness, and insomnia, the following combinations of points has been found effective. Here, Gallbladder 34. The point is located just below and in front of the fibula bone, on the side of the leg below the knee, and it is treated with a circular motion for 1 to 2 minutes. The next point is urinary bladder 62. This point is located beneath the outer tip of the ankle. The point is a very sedative point. In states of anxiety, these points should receive a prolonged treatment. Firm massage with the forefinger for 2 to 3 minutes. The treatment may be repeated after 1 hour. Heart 7, at the end of the wrist crease on the small finger side, next to a bulge in the bone. The point should be massaged firmly with the nail for 1 to 2 minutes. The next point is pericard 6, located 2½ finger breadths above the wrist crease, between the two bones. It is also a psychologically sedative point. When massaged strongly, a feeling of pressure should develop in the depth of this point. In the treatment of a common cold with a runny nose and sore throat, the point stomach 2 is massaged. This point is located 1 finger breadth below the eye in a groove. Large intestine 20 is located next to the nose and is massaged with a circular motion. The local points of the face are massaged for 30 to 60 seconds. Triple heater 17 is located in the groove behind the lobe of the ear. This point is most effective in case of sore throat, but should only be massaged gently. These are the local points for the face area. Next, as distant point, large intestine 4. In case of common cold, this point should be treated for 1 to 2 minutes, and the treatment can be repeated hourly. Large intestine 11, at the end of the elbow crease, when the arm is held at a right angle in the muscle. The point is massaged firmly for 1 to 2 minutes. The point spleen 10 has a strong immune-enhancing effect. It is located 3 finger breadths above the kneecap, on the inner side of the leg, at the highest point of the muscle visible here. The point should be massaged in a circular motion and with firm pressure. An additional distant point on the leg is spleen 6, the width of the patient's hand above the inner tip of the ankle, at the edge of the bone. Massage firmly with a circular motion for 1 to 2 minutes. With the technique of Moxibustion, acupuncture points are heated with the help of a so-called moxa cigar, which is ignited. Moxibustion strengthens the body energies and the energy of the individual organs in case of weakness. Traditional Chinese medicine describes a whole group of illnesses due to weakness or a depletion of the body's energy. In these disorders, cold hands and feet and less tolerance for cold are common, as well as general fatigue and exhaustion and a dampened or depressive mood. Moxa cigars are made out of the dried leaves of the Artemisia vulgaris plant and burn just like a regular cigar. Before Moxibustion, the designated points are first marked with a felt pen, here the point lung 9. Next, large intestine 11, at the end of the elbow crease when the arm is held at a right angle. These are effective activating points. The moxa cigar is held above the point at a distance of approximately 1/2 to 1 centimeter. When the heat becomes too strong, move further away. Then approach the point again. This should be repeated for 6 to 8 times. A slight redness will have developed at the point. Naturally, it is very important not to burn the skin. The treatment of a point takes about 30 seconds. Then approach the next point and await the feeling of heat, and repeat this 6 to 8 times. Lung 9, at the end of the wrist crease on the thumb side. Large intestine 11 is a strong activating point. Moxibustion treatment should be repeated daily, especially in the colder time of year. Approach and retreat from the point when the heat becomes too intense. A Moxa cigar lasts approximately for 3 to 4 treatment sessions. Next, the point spleen 6 is marked, the width of the patient's hand above the inner tip of the ankle at the edge of the bone. 1 thumb below is the point kidney 7, an important tonifying point for the kidneys. 1 finger breadth behind this is kidney 8. At the end of the knee crease is liver 8, an important point for the activation of the liver. The treatment of these points strengthens the internal organs. The treatment of the points is done in the same way as the points on the arms are treated. These 3 points here are very sensitive. Therefore, great caution is necessary not to burn the skin. These points are also effective in cases of bladder problems. Moxibustion should not be practiced during fever or in the case of infections or during menstruation. Also, if the patient is nervous, anxious, or excited, the physician should be consulted before moxibustion. Liver 8 is an important point for the tonification of the liver energy. Approach and retreat when the heat becomes too intense. Each point is treated for 20 to 30 seconds. Two finger breaths below the umbilicus is an important tonifying point. In Chinese, it is called Sea of Energy. The navel itself is also an important activating point. But be very careful not to burn the sensitive skin in this area or the navel. These points should also be treated for 20 to 30 seconds, or until a slight redness has developed. Alternate from one point to the other. In the waist region, 2 finger breaths next to the midline, there are 2 important points for the activation of body energy. Urinary Bladder 23. Great care is indicated here. These points have a strong activating effect on the kidneys. These points are very useful in case of poor tolerance of cold and should be treated intensively. Treatment of urinary bladder 23 on both sides. Against chronic backache and a cold feeling, an area above the sacrum, 2 finger breadths next to the spine and parallel to the midline, is heated. It is marked here. Move the moxa cigar slowly over the area, up and down, for 30 to 60 seconds on either side, until a slight redness will develop. Alternate from one side to the other, and take care not to burn the skin. First positive effects can be expected after 2 or 3 days, but treatment must be done daily. In cases of weakness and lack of appetite, and in certain cases of diarrhea, the following combination has been found effective. Stomach 36, 1 finger breadth next to the bulge in the bone at the upper end of the shin bone. This is an important tonifying point for the stomach energy. This point should be treated very intensively. For stomach disorders, a combination of points in the area of the umbilicus are selected. Stomach 25, 2.5 finger breadths next to the navel. Ren 6, Sea of Energy, 2 finger breadths below the navel. Ren 12, 5 finger breadths above the navel. In the abdominal area, all points must be treated very carefully. Ren 12. Approach and retreat when the heat becomes too intense. Stomach 25. Ren 6. Sea of Energy, 2 finger breadths below the navel. Stomach 25. And Ren 12. Moxibustion can also be done with the direct use of moxa powder. A ginger slice is used for insulation. First, fresh ginger is cut into slices and a cone of moxa is placed on it. The cone is ignited. The ginger slice with the moxa cone is placed on the acupuncture point. As soon as a strong feeling of heat develops, the slice and cone are moved to the next point. This is repeated 6 to 8 times for each point. Here you see the cone of moxa powder, which has been ignited. It can be moved easily on the ginger slice from one point to another. This method is highly effective, and although it seems more complicated, it is preferred by many patients. This method is naturally applied to the same points as were shown before. This method is naturally applied to the same points as were shown before.